He was fine before the hospital. What happened? After changed everything. Can I ask you something personal? Have you ever seen an older loved one go into the hospital for something routine, maybe a surgery, an infection, or even just dehydration? And when they came home, they weren't the same. They were more confused. They stared off. They asked the same question over and over. They looked at you, but didn't really see you. And you thought, maybe it's the anesthesia. Maybe he just needs a few days. But days turn into weeks. And the person you knew feels like they're slipping further away. That heartbreak has a name. It's called delirium. And it's not a passing phase. It's not just getting old. According to the Journal of the American Medical Association, older adults who experience delirium in the hospital are twice as likely to die after discharge, more than twice as likely to be placed in a nursing home, and almost 12 times more likely to develop dementia. 12 times. Delirium is not a symptom. It's a red flag, a brain in crisis, and too often it's misunderstood, misdiagnosed, and missed entirely. That's why today's video matters. Because if we understand what delirium truly is, we can learn how to prevent it, how to catch it early, and how to protect our loved ones from slipping away silently. Have you ever seen someone close to you go through this kind of change after a hospital stay? If yes, leave a 1 in the comments. If no, leave a 0. I read every response, and your story might help another family not feel so alone. Let's begin. Number 1, it's not just aging what delirium really is and why it's so dangerous. Let's take a breath. Because this next part is something most families never get told until it's too late. Delirium is not dementia. And it's not just old age. Delirium is a sudden, drastic change in the way the brain works. It can show up as confusion, agitation, drowsiness, disorientation, or even hallucinations. It can last for hours or days. Sometimes it goes away, but sometimes it doesn't. The key word here is sudden. Dementia develops slowly. Delirium often happens within hours or a few days, especially during a hospital stay. Here's how you might spot it. A person who was alert yesterday is now groggy or restless. They don't know what day it is. They can't focus on a simple question. They say things that don't make sense. Their mood changes quickly from calm to panicked. And yet doctors, nurses, even family members often miss it. Why? Because we expect older adults to be a little confused. We assume they're tired. We think it's normal after surgery or illness. But here's the truth. Confusion is never just normal. It's always a message. And when it comes on suddenly, we need to listen carefully. Delirium is usually caused by something reversible, like an infection, a reaction to medication, dehydration, or sudden change in environment. But if we don't catch it in time, it can leave a lasting mark, especially on the aging brain. One study from Harvard's Division on Aging found that up to 40% of hospital delirium cases go unrecognized, even in top hospitals. That means thousands of older Americans are discharged every year with a brain injury that no one documented, that no one explained. So let's change that. Let's start seeing delirium for what it is, a serious, urgent, and treatable condition, one that deserves attention, compassion, and proper care. Have you ever mistaken delirium for dementia or seen others do so? If yes, share your experience in the comments. Your insight might help someone catch it in time. In the next section, we'll break down the 3 most common myths about delirium and how those beliefs are putting older adults at risk every single day. Number 2, 3 dangerous myths about delirium. That could cost a life. Let me ask you something gentle but urgent. Have you ever been told he's just confused because he's old, or that's normal after surgery? Maybe even she just needs rest. Don't worry. Those words may sound comforting, but they can be dangerously misleading. When it comes to delirium, what we don't know or assume is often what hurts most. Let's go through 3 common myths I see over and over again in hospitals and families. Myth number 1, it's just part of aging. This is perhaps the most common and the most harmful. Yes, the aging brain changes. But confusion that comes on suddenly is never normal. Delirium is not a natural part of growing old. It's a medical emergency. The brain is waving a red flag saying something's wrong. If we shrug it off as normal, we miss our chance to act. Myth number 2. They're just tired from surgery or medication. Fatigue is real. But delirium is more than just being tired. A person with delirium may suddenly not know where they are, what year it is, or who's in the room. They may lash out, cry, whisper, or fall silent. This is not normal recovery. It's the brain struggling to make sense of itself. And while it may overlap with medication effects, delirium needs to be recognized on its own. Myth number 3. It'll go away on its own. Sometimes it does, but too often it doesn't. In every hour we wait, the brain becomes more vulnerable. Delirium increases the risk of permanent memory loss, falls, prolonged hospital stays, and even death. The longer it lingers, the deeper the scar. So what should we do instead? Don't assume. Ask questions. Speak up for your loved one. If something feels off, say it out loud. The sooner delirium is recognized, the sooner it can be reversed or at least stabilized. Which of these myths have you heard before? Leave a comment 1, 2, or 3, and tell me how it showed up in your family or hospital story. In the next part, I'll explain why delirium so often gets misdiagnosed and how you can help your doctors catch it early, because no one should lose part of their mind simply because no one paid attention. Number 3, why delirium gets missed, even in good hospitals. Delirium is not always easy to see, not because it's rare, but because it's unpredictable. It doesn't follow a schedule. It doesn't always look the same. One moment, the person is alert. Next, they're lost. Then, just as suddenly, they're back to normal until it happens again. This back and forth confuses everyone: doctors, nurses, even families. And that confusion often leads to misdiagnosis, or worse, no diagnosis at all. So why is delirium so commonly missed? There are a few key reasons. 1, it mimics other conditions. Delirium can look like dementia. It can look like depression. It can even be mistaken for medication side effects or post-op grogginess because it shares symptoms like confusion, withdrawal, or fatigue. Healthcare providers may not realize the brain is in acute distress. 2, it fluctuates. Delirium doesn't stay still. It can come and go within minutes or hours. That means if a doctor walks in during a good moment, they might miss the signs. And without consistent observation, especially from people who know the patient well, it's easy to overlook the shifts. 3, it's not always documented. Hospitals are busy. Staff rotate. Notes get missed. Subtle changes like talking a little less or seeming more withdrawn can be overlooked or dismissed. Delirium doesn't always scream. Sometimes it whispers. And in the noise of a hospital, whispers are easy to ignore. So what can we do to help? Speak up. If something feels different, say it. Even small changes matter. Use clear language. Say, She was fine yesterday. Now she's confused. Stay present. Family observations are often the first clues that something's wrong. Ask directly, could this be delirium? It's a simple question and a powerful one. The goal isn't to criticize medical teams, it's to collaborate with them. Because early recognition can mean faster recovery, fewer complications, and better outcomes. Have you ever been unsure how to speak up in a hospital setting? Leave a yes or not sure in the comments. This is a space where your voice matters. In the next part, we'll explore what causes delirium and, more importantly, what you can do at home before a hospital stay to lower the risk. Because prevention doesn't start in the ICU. It starts in everyday care. Number 4, what causes delirium and how you can prevent it before it starts. Delirium may seem sudden, but in most cases, it doesn't come out of nowhere. There are triggers. Small things that pile up, weaken the brain's defenses, and make it vulnerable. And the good news is, many of those triggers can be managed, often long before a hospital stay. Let's walk through the most common causes of delirium in older adults and how you can lower the risk starting today. 1, medication overload. Older adults often take multiple prescriptions, some of them especially sedatives, anticholinergics, or painkillers can interfere with brain function. The more medications you take, the higher the risk of interactions or cognitive side effects. What helps? Keep an up-to-date medication list. Review it with your doctor or pharmacist every 6 months. Ask, which of these could increase confusion? 2, dehydration and malnutrition. The brain runs on hydration and energy. When the body lacks water or essential nutrients, mental clarity fades, especially in aging brains. What helps? Drink water regularly, even before you feel thirsty. Focus on simple nourishing meals, protein, fiber, healthy fats. Avoid skipping meals, especially before medical visits or procedures. 3, poor sleep and sensory deprivation. A lack of restful sleep or being in an unfamiliar, noisy, or dim environment can disorient the brain. Add hearing or vision loss, and the brain loses even more grounding. What helps? Maintain a consistent sleep routine. Bring glasses and hearing aids to any hospital visit. Keep the lighting gentle and familiar at night. 4, sudden change in environment. Even a short hospital stay can feel overwhelming. New faces, beeping machines, interrupted routines. The brain, already stressed, begins to misfire. What helps? Prepare ahead. Bring comforting items from home, a blanket, a clock, familiar music. Let staff know what's normal for your loved one so they can spot changes early. Delirium is not always preventable, but by strengthening the brain's baseline with hydration, sleep, nutrition, medication awareness, and emotional grounding, you increase resilience. You give the brain a better chance to stay steady even during stress. Which of these prevention tips do you already follow, and which ones might you start this week? Share your answer in the comments. Because of small steps today can prevent big heartbreaks tomorrow. In the next part, we'll explore how to care for someone who's already showing signs of delirium and how to protect their dignity while helping their brain heal. Number 5, how to care for someone in delirium. Without adding to their confusion, when someone you love is going through delirium, it can feel like they've disappeared. They may not recognize you. They may say strange things. They may act afraid, withdrawn, or even angry. It's confusing. It's heartbreaking. And it's hard to know what to do. But your presence matters more than you realize. Delirium is not just a medical problem. It's an emotional and environmental one too. how we care for someone in that moment can shape how fully their brain recovers. Let's talk about what helps and what doesn't. What helps? 1. Speak slowly and gently. Use short, simple sentences. Avoid correcting them harshly. Reassure with warmth. You're safe. I'm here. 2. Maintain a calm environment. Keep noise low. Dim the lights in the evening. Use familiar music or a gentle clock ticking to anchor them. 3. Reorient with kindness. Tell them the day, time, and place. Show them a window. Give them a small calendar or photo of home. Repeat gently without frustration. 4. Support their routine. Encourage regular meals, walks, toileting. Consistency is grounding. The brain thrives on rhythm. 5. Minimize physical restraints, unless absolutely necessary for safety. Avoid tying or locking. Delirium worsens with fear or helplessness. Freedom within safe boundaries helps heal. What to avoid? Don't argue. Don't say, "You already asked me that." Don't leave them alone for long stretches. Don't dismiss their fears, even if they sound illogical. Delirium is a crisis of connection. What the brain can't anchor in logic, it will seek to anchor in feeling. And when that feeling is safety, when it is warmth, when it is you're not alone, the healing begins. Have you ever helped care for someone with delirium? What helped the most or what was hardest? Share in the comments below. You're not alone in this. Your story might be someone else's roadmap. In the final section, we'll bring everything together, and I'll leave you with one message I hope you'll carry long after this video ends. Delirium. Today could speed up Alzheimer's tomorrow. Here's what you can do. You've watched closely, learned how delirium can sneak in, how it can be misunderstood, and how it can hurt the brain deeply. Now here's the final, most important truth. Delirium isn't just temporary confusion. In someone already at risk, especially those with early Alzheimer's, it can accelerate cognitive decline. A study in neurology shows that older adults with early Alzheimer's who experienced delirium declined in thinking and memory twice as fast as those who did not. Twice as fast. That means what might seem like a passing mental fog can actually speed up memory loss and push someone from mild confusion into serious dementia, months or even years sooner. But here's the light in the dark. We can change that. By preventing delirium by catching it early, we're not just helping short-term recovery. We're buying precious time, slowing down the decline, your attention, your voice, your presence. That's the difference. So, here's my gentle ask. If today's video made you feel seen, empowered, and more prepared, please subscribe to the channel, because in our next episode, we're going deeper into how delirium interacts with Alzheimer's and what practical steps families can take to protect loved ones with cognitive impairment. And I want to ask you, do you have a family member or friend with mild memory loss? Would you watch a video about preventing delirium in early Alzheimer's? Drop a yes. Or, I'd like that below. Your feedback shapes our content so we can serve you better. Thank you for taking this journey with me. Together, we can make a real difference. Until next time, stay gentle, stay present, and keep caring for your beautiful brain.